Hi, I'm Michelle White. I'm presenting this research titled Literacy Levels, Acculturation, and Self-Care Among Portuguese Immigrants on behalf of Dr. Kristen Sitharis and Dr. Cheryl Westlake. 320,000 Portuguese immigrants live in southeastern Massachusetts alone. This region has the largest number of Portuguese immigrants in the country. In general, immigrants have healthcare challenges due to issues with access, language barriers, and cultural differences. The level of acculturation, that is, the process of incorporating the new country's language, culture, and values, may impact healthcare among immigrants. Health literacy is the ability to obtain, process, and understand basic health information to make health decisions and navigate complex healthcare systems, and this can impact both health and clinical outcomes. 36% of Americans have inadequate health literacy. Little is known about factors that may influence health literacy in Portuguese immigrants, however. Therefore, the purpose of this study was to evaluate the role of health literacy, social support, and acculturation on self-care maintenance and management of heart failure in Portuguese immigrants. Demographic data was obtained through surveys and electronic health records. Language acculturation was measured through the English Language Acculturation Scale, or ELAS. Measures of self-care, health literacy, and social support were also obtained using valid and reliable surveys. This study included a convenient sample of 116 Portuguese individuals with heart failure who were admitted to a community hospital. Participants were, on average, 75 years old, had 9 years of education, and had an average of 3 comorbidities. 50% were female, 59% were married, and 46% reported having enough income to make ends meet. Participants had lived in the United States for an average of 32 years. 62% of participants had marginal or inadequate health literacy levels. 89% of participants reported some level of social support. Despite living in the United States for a long period of time on average, the mean ELAS score was 2.7, which indicates that many participants still prefer to speak Portuguese. Self-care maintenance and management scores were found to be inadequate. Age, education, acculturation, and social support were all found to relate significantly to health literacy. Health literacy was then related to self-care maintenance. Hierarchical regressions were also conducted on these variables. After controlling for age and education, social support, ELAS, and health literacy explained an additional 11% of the variance in self-care maintenance and an additional 21% of the variance in self-care management. ELAS was the most significant independent predictor of self-care maintenance. Despite living in the U.S. for many years, again 32 years on average, most participants had inadequate or marginal health literacy levels and preferred to speak in Portuguese. The research found several implications worth noting. The level of language acculturation was predictive of self-care maintenance behaviors. Providers should therefore assess language preferences of individuals, regardless of how long they have been in the United States, to ensure care and education is given in the preferred language. Additionally, as many Portuguese Americans may live in multi-generational families and have adequate social support, involving family members in self-care teaching may help to bridge this cultural gap and promote improved self-care practices. Thank you.